Hello students, we will discuss again not uncommon entity which we come across in surgical side. Many times it will be seen by the ENT people also, sometimes in other specialty also, but basically it's general surgical entity as such. So find out what are the differential diagnoses for this swelling. See that in the left side there is a swelling here, mandible margin is here. You can see that touched skin here, you can see the turnomasted muscle, it is in the submandibular region. If you look at the level, I will say level 1B, probably 1A is here, 1B is here. So this area, you can see this is the touching of the platysma here. So you can see that this is the touching of the platysma. Turnomasted muscle is here actually. So it's a very typical anatomical region. This swelling is there. Of course, you have to examine the oral cavity. You have to look for the vital palpation, skin warmness, skin fixity, mobility, whether it's fixed to the bone, bone erosion, bone thickening, vital palpation, other neck node levels, opposite side examination, systemic examination, oral cavity examination is a must. Any swelling in the neck, oral cavity should be examined. Any lesion in the oral cavity, neck should be examined. Otherwise, we will miss a bus. That's the most crucial clinical point which you have to remember always. And submandibular salivary gland tumor could be malignant, remember this point is this area. And second is in the neck. These are the two things comes immediately to your mind as a different such a large swelling. You don't think benign entity that easily in this condition, in this patient of course. And next thing of course, you think of tuberculosis, unlikely, but you have to think of anywhere tuberculosis may be a differential diagnosis, especially that holds good in the neck as a neck swelling. So these are the differential diagnosis which you have to remember. What relevant clinical examination should be done? Proper clinical examination, mobility, fixity to the skin and submandibular muscle, deeper plane, fixity to the mandible. Already told all neck level neck nodes, both sides. 1A, 1B, 2, 3, 4, 5. 1A, 1B, 2, 3, 4, 5. All level neck nodes, spine should be examined, systemic examination should be done, oral cavity should be examined, bilateral palpation, the mandible should be done, oral cavity should clearly, everything about oral cavity should be done properly, examination. And bilateral palpation, I already told, hypoglossal nerve, because hypoglossal nerve involvement comes here. So ask the patient to put the tongue out. Tongue deviate to the same side, that's important. Tongue deviate to the same side, not to the opposite side, with a wasting seen in the tongue, same side of the tongue muscle. We can compare to the opposite side. It's a very typical hypoglossal nerve comes here, you have to look for that. And systemic exam, especially spirit system, should be assessed properly for spread or mainly for aspiration pneumonia also can develop. So spread or pneumonia, whatever it is, you have to look for systemic respiratory system in this patient. So how to manage? Ultrasound next, CT scan is a must, FNAC of the swelling, and treatment is for submandibular salivary gland tumor, radical excision with the neck nodal clearance, of course, with the adjuvant chemotherapy and radiotherapy. Second is in the look for primary, do triple endoscopy, blind biopsies, PET CT, then go ahead and see whether it's occult primary or known primary. Then accordingly you manage. So that is how exactly you manage this patient. It's a very common short case kept in the exam or oxy. So you have to know how to manage these patients. So go through my clinical examination, SRB clinical methods in surgery to have the idea how to examine neck swelling and oral cavity and salivary gland swelling, and my manual of surgery for detail about salivary gland tumor, neck swellings. It will give detail about second is everything, and operative surgery shows neck dissection, oral cavity resection, different malignant lesions, how to resect also, and atlas of tissue approximation for proper suturing technique. My DigiNour lectures are available through JP Publishers. So you can go through, subscribe for a year. Every topic is in detail discussed with the lecture properly, of course including specialties, operative surgery, X-ray specimens and instruments. So please subscribe for a year. It will be very, very helpful for your exam. So students, I hope you understood this swelling very well. Thank you very much.